Hello everyone, myself Dr. Jyoti Gautam. I'm working as a consultant neurologist in Kailas Hospital, Dehradun. Today I'm going to talk about quality of life issues in epilepsy patients. We all know that epilepsy is a chronic illness that is associated with profound physical, psychological, and social consequences, which impairs the quality of life. It's because several factors, but important factors are the unpredictability of seizures as well as the stigmas associated with the epilepsies. And the unpredictability is because of the seizures severity and the frequency of seizures that varies from person to person. So there are a few key areas of quality of life that are mainly influenced by the epilepsy. First one is the education. Education received by the epilepsy patients varies because of the seizure frequencies. It's because of the inadequate schooling. Also, the average intelligence in patients of epilepsies. It's not always true. It is only sometimes true when the epilepsy starts very early in the life. So the cognitive impairment in patients of epilepsies are itself because of the seizure frequencies, the frequent seizures, even the effects of antiepileptic drugs, and the inadequate schooling because of the recurrent seizures. These all things leads to cognitive impairment that is most commonly in the area of memory, mental slowing, and attention deficits. Coming to the second next point, that is the employment. The unemployment is very important issues in persons with epilepsy, and it is found that it is 2 to 3 times greater than the general population in respect to epilepsy patients. So it's because the epilepsy patients finds difficult to find a job that is suitable to their illness. Usually, we suggest epilepsy patients to avoid the places which require frequent driving, which require swimming, which require working in a place having a great height of fire-related works. The independence, the physical disability in persons of epilepsy limits the physical independence. The fear of having the seizures, the cognitive consequences of the epilepsy and its treatment, and the ineffective treatment of epilepsy also hinders the independence in patients. Like a patient having difficulty in getting the driving license because of the uncontrolled seizures. So effective seizure control is very important to have the physical independence in patients of epilepsies. Coming to the next point, that is social isolation. This can be because of the reduced self-esteem in patients of epilepsies. That can lead to feeling of helplessness and also depression. It is found that depression is very common in patients of epilepsy. That can be because of epilepsy seizures itself or because of the effects of anti-seizure medications that can lead to the social isolation and reduced quality of life. These are the few important factors that are affected in the quality of life issues in patients of epilepsies that should be kept in mind, and while treating the patients, this should be addressed frequently. Thank you.